Hello from us here at Nicopure Labs. I'm Patricia Kovacevic, Chief Compliance Officer and General Counsel, and I have the privilege of being here today with Dr. Chris Russell, who's a psychologist and tobacco harm reduction researcher with the Centre for Substance Use Research in Glasgow, Scotland. Dr. Russell has conducted and published a large number of studies on tobacco harm reduction and has great expertise in e-cigarette and vaping products use. So, Dr. Russell, thank you very much for taking the time to be here with us. I know you travel a lot around the world. In fact, a few minutes ago, we were talking about your upcoming trip around the world from Glasgow to Las Vegas via New Delhi.
Yes.
During your travels, I know you have the opportunity to interact with a number of government official and public health organizations. And just recently, you were in fact in Colombia, in South America, which is a country that at present doesn't have a very friendly approach towards vaping products. Can you share a little bit your experience with the people you engaged in Colombia? What was their attitude? Were they receptive to, in fact, the harm reduction proposition that e-cigarettes and vaping products have?
Sure. So a couple of weeks ago now, I was invited to Bogota, Colombia, to participate in a forum discussion, the subject of which was whether e-cigarettes represent an opportunity or a threat to public health, and what might the role be for e-cigarettes in the tobacco control strategy in Colombia. And the people who were attending this forum were physicians, media, some politicians, some academics and other people working in public health and tobacco control. And the opportunity was there for me to come and tell the people, regulators and public health people in Colombia about the experience of e-cigarettes in the United Kingdom, what our story, our relationship with e-cigarettes and tobacco harm reduction has been over the last 9 or 10 years. And I explained to the forum when I was there that in Colombia the e-cigarettes are just emerging. There's a hesitance to embrace or reject one way or another. There is a different precautionary attitude towards e-cigarettes, that not enough is known about them, and there's a lot of myths and misinformation flying about e-cigarettes, and so the current predominant attitude is that the e-cigarettes are something that's to be sort of rejected for the time being, or it shouldn't play a major role in tobacco control in Colombia.
So the government there basically does not put out any communication that would basically describe the comparative risks of e-cigarettes versus smoking, correct?
No, and I think from attending the forum, what was clear is that little is known to the Colombian officials about the comparative risk. They were largely unaware of many studies that have been conducted to assess the risk to human health associated with tobacco smoke versus e-cigarette vapor, the effects of short-term inhalation of smoke and vapor, and the differences in ingredients and emissions of a tobacco cigarette and an e-cigarette. So there was a broad lack of awareness, I would say, of the number of studies that have been conducted in the US and in the UK and throughout Europe to try and characterise the toxicological risk profile of e-cigarette products in comparison to smoked tobacco products.
What were some of the questions that you received that seemed more provocative during that visit?
Well, there's a concern about nicotine, and I would say a misunderstanding about what nicotine is and what it does, and specifically its relationship to the development of smoking-related diseases. There's a fairly strong belief that nicotine doesn't only cause addiction to these products, or to tobacco products or to vapor products, but also that nicotine is a molecule that causes the development of lung cancer, cardiovascular disease, COPD, and other smoking-related diseases. So there's a belief, or a mistaken belief, a misperception that nicotine is is an active contributor to the development of those diseases. And so part of my role being there was to explain that the three main diseases that are associated with tobacco smoking, lung cancer, vascular diseases, and COPD, are caused by the direct effects of smoke. They're not caused by nicotine use. And therefore,
so it's the tar in the smoke,
it's the
really.
tar and other toxins that are found that are carried in tobacco smoke. Yeah. So the principle of harm reduction is that harm reduction can help people who haven't responded by quitting smoking to all the conventional tobacco control measures. That there's something that can be done to prevent or reduce harm in those people that current conventional measures aren't achieving, and that tobacco harm reduction works by providing smokers with the nicotine upon which they are dependent or feel they need to function properly in the world throughout their daily life, but without exposing them to the smoke that will that ultimately causes the development of smoking-related diseases, and ultimately causes the premature death of 1 in 2 long-term smokers. So I explained that the basic principle of harm reduction was that you can have nicotine without smoke, that people can consume. If smokers can be persuaded and encouraged and assisted to switch to a smoke-free source of nicotine, then according to groups like the Royal College of Physicians in the UK, then the life expectancy of today's smokers could be radically improved, and almost all of the harm that's caused by smoking could be prevented in those people who switch. So I was there really to make the case for e-cigarettes as something that can really help to prevent and reduce smoking-related harm in people who are not responding to professional encouragement to quit, professional assistance to quit, to existing tobacco control measures. It was really to say how tobacco harm reduction is not an alternative to those measures, it's merely an addition. You continue to do everything you're already doing, but for the people who are not benefiting from those measures, you can take a tobacco harm reduction approach, and part of that involves education around the comparative risks of using an e-cigarette instead of continuing to smoke.
Right. And so have you observed, if you did a market visit, have you observed any vaping products being sold in Colombia?
It was interesting. The prevalence of vapor product use is very low. Mm-hmm. I understand in Colombia. I did, however, speak to some members of local vaping groups who were admittedly very small. But they actually, what was encouraging was that they take their inspiration from larger groups here in the US, like CASA, or in the UK, like the New Nicotine Alliance. So they see that there's a small population of people who used to smoke. They started using a vapor product. They quit smoking. They feel better. They feel their health has improved, and they want to become a vocal advocate. Someone who will go out and tell other smokers about the risks of smoking versus vaping and the benefits of switching to a vapor product.
And that would be the benefit to them as an individual, of course.
The benefit to their health, primarily to their health. And these are people, and this isn't just Colombians, we've spoken with thousands of people who have quit smoking by using an e-cigarette. And the story is always the same for these people. These are people who maybe smoked for 10, 15, 20 years. They smoked 20 cigarettes a day. They felt somewhat highly dependent on cigarettes. They tried any number of ways to quit, all the approved methods and products to quit. Those products largely weren't successful. They maybe quit for a month or two at a time, but ultimately went back to smoking. They're feeling very deflated with the whole process, about to give up on giving up. Then someone offered them an e-cigarette one day and said, give it a try. They tried it, maybe they didn't like it the first time, but they eventually found a device and a flavour and a nicotine strength that they liked and worked for them. Gradually they cut down their smoking, quit all smoking altogether, and continued to use their vapor product. And then they say that, from the early days of of switching, that their health drastically improves. They have less cough. They don't cough up as much phlegm. They have more energy. They don't get as breathless walking up a flight of stairs.
Right.
This is just a common story. So, these people in Colombia, the small population who are living that journey, living that story, they now want to get together and go out and tell the current smokers, look, there's a safer alternative. If you feel your health is suffering already, then switch. If you're worried about your health in the future, then switch. If you're seeing other people's health suffering as a consequence of smoking, switch. It's never too soon to switch. It's never too late to switch. And there's people here that can advise you on how to switch and what to expect when you switch. And just there's a support network. There are people like you who struggle to quit, were able to do it, and now they're here to help you. They're here to advise and support. And so this small group in Colombia hopefully will only get larger as more people take up vaping in place of smoking and sort of experience the benefits and then want to pass their experience on to the next group of smokers who are thinking about using an e-cigarette.
That would be a great solution if the government cannot provide the necessary information. Certainly vapers are organizing themselves. Yes. Speaking of governments, and we mentioned the United Kingdom, which is where you're from, what a difference, isn't it, between the way the United Kingdom and Public Health England, which is basically the Ministry of Health or part of the Ministry of Health in the UK, is communicating options for smokers who cannot otherwise quit with medicinally approved products. And what a difference between what happens in the UK and what happens here in the US, where doesn't really seem to be any kind of communication surrounding e-cigarettes, other than the occasional tweet out from the FDA saying, "Oh, e-cigarettes may explode," or the only safe alternative is really to quit entirely smoking, which is certainly the best option, but not available to everyone. Can you share with us some of the most recent developments in terms of what communication the government in the UK is putting out through the smoke cessation counselors, some examples of information that smoke cessation counselors now are obliged to provide to smokers when asked about e-cigarettes in specific?
Sure. Well, just to start with the Public Health England report published in 2015, if you read the summary, the executive summary to that document, they say that the motivation for undertaking this review was that the prevalence of e-cigarette use had increased dramatically since the last time a review had been conducted, and also that there is a widespread belief. There was a widespread belief that using e-cigarettes was as harmful, or in some cases more harmful, than smoking regular cigarettes. And the review, the conclusions of the review, were meant to address that misperception. So the Public Health England realised that here we had evidence of a substantial reduction in risk for people who switched from smoking cigarettes to vaping an e-cigarette.
So in other words, forgive me for interrupting,
Sure.
The government put out this report because they were concerned that the population thought e-cigarettes were actually very bad for themselves.
Yes.
And actually the government took steps to correct that misperception.
Yes.
Isn't that amazing?
So one of the main sort of recommended action points from the Public Health England report was that once they had arrived at the conclusion based on the review of evidence that vaping was around 95% less harmful than smoking a cigarette, and that using an e-cigarette can be effective as part of an attempt to quit smoking. Once we've discovered that from the evidence, the conclusion was that there is now a need to publicise this information to the general public and to the smoking population. There's a need to let it be known that vaping is significantly less harmful to an individual's health than continuing to smoke.
And that translated also in guidelines for smoke cessation counselors,
yes,
isn't it?
So I mean, earlier this year in 2016, the Public Health England in association with the National Centre for Smoking Cessation Training produced a document for smoking cessation services, and it was very roughly a guide on how to talk to people about e-cigarettes. People who come into their service, how should you talk, what information should you give about e-cigarettes, how should you advise and support, and so on. And this guidance document contains all the information a smoking cessation counsellor would need when asked about, so if a person were to ask about e-cigarettes. And very broadly, that the guidance is to encourage and support any person who wants to use an e-cigarette as part of their attempt to quit smoking.
So, for instance, what are they saying about dual use? If I come to a counsellor in the UK and I tell him I'm a smoker, but perhaps I want to vape at the same time with smoking, what's that going to do to my health?
So there is a page in the report which is a response to the hypothetical question which commonly gets asked: is it okay to smoke and vape at the same time? So when I'm switching, is it okay if I both use my e-cigarette and continue to smoke cigarettes? And the answer that we give to people is yes, it is okay to dual use for a time. We appreciate that you didn't become a 20-year, 20-a-day smoker overnight, and that moving away from tobacco is going to take time, and you may feel that you need to smoke a cigarette occasionally or a number of cigarettes daily as you work towards quitting. The critical thing in our approach is that we say, as long as you are working towards reducing your cigarette consumption, your daily cigarette consumption, then use the e-cigarette as well. If you find that the e-cigarette helps you cut down the number of cigarettes you're smoking every day, then use the e-cigarette. And however long it takes you to reduce, as long as you are working towards reducing your cigarette consumption down to zero, which is the best thing for your health, then great, we'll support you and we'll encourage you to keep using an e-cigarette.
And we're talking here about commercially available e-cigarettes. We're not talking about prescription e-cigarettes, just to be clear, because certainly my understanding is at present there are no current e-cigarettes as such that are approved for cessation from the products that we know, the vaping products we're used to. So basically, just to summarize what you're saying, counselors accept that even a commercially available non-medicinal product is helpful in reducing the number of cigarettes smoked, progressing towards zero, and they in fact communicate that fact to the smokers.
Yep, and it's we acknowledge that there's always a continual need for us to study these products, to study people who use them and how they use them. But at present, the evidence says that these are products that can help you quit smoking. They are substantially less harmful than continuing to smoke. And therefore, for these products to have the maximum public health benefit, this information needs to be spread far and wide. And translating how that translates into regulation is we need to make sure that these products that can help people quit smoking and are substantially less harmful than smoking, we need to make sure that they are available, affordable and attractive to smokers. We need to make sure they are available everywhere that cigarettes are available, and we do, and in other places, specialised vape shops. For these products to be a viable alternative to smoking, they have to be easy for people to get, for smokers to get, as easy or more easy than it is for them to get cigarettes. That's not how we started. This position now is the product of years of study of both the products and the people who use them. Back in 2007, the Royal College of Physicians recommended, when e-cigarettes were just emerging onto the market, the Royal College of Physicians recommended that they be regulated as medicines, prescribed by a doctor.
But they moved away
subsequently, as more and more studies of the toxicological profile of the products came in, as more population surveys of the users came in, they adapted to the evidence and said no. Just in 2016, they said no. To regulate these products as medicines would actually not allow them to fulfil their potential. in helping smokers to quit, and so they have to be available as general consumer products, and that recommendation came with a warning to other governments, I suppose, that any regulation that delays or discourages a smoker from switching to a non-tobacco nicotine product will ultimately keep people smoking and perpetuate the harm of smoking to the population.
That's a very wise constatation. What about vulnerable populations? So in that same guide for counselors, obviously there is a section or more sections that talk to advice to vulnerable populations such as pregnant women. And that's a very delicate question because while nicotine certainly does not cause cancer, it's not entirely harmless. And I think for full disclosure, one of the things that scientists are worried about is perhaps the harm of nicotine on fetal or on birth weight in children, or perhaps premature deliveries and things like that. However, pregnant women smoke, some of them smoke, and therefore they're entitled to some form of advice. What is the advice given by counsellors in the UK, again, as advised by the government?
So again, we have to be very pragmatic about how we deal with this, the problem of smoking during pregnancy. The fact is, we have pregnant women who smoke. The other fact is that many of them will not be convinced or persuaded to stop smoking by conventional tobacco control measures. They will continue to smoke. And the tobacco harm reduction perspective is we need to find a way of helping that group of people as well. We need to find a way of preventing or reducing harm to this group of people who clearly want to continue using nicotine in some way. So whereas we always say that the best thing a smoker can do for his or her health is to quit all tobacco and all nicotine use completely and at the soonest opportunity. It's the best thing that they can do for their health. But if they are insistent on using nicotine in some way, we would much rather they used an e-cigarette than continue to smoke. And that applies to all people, healthy people, unhealthy people, pregnant women. Even we have guidelines or recommendations for people who are incarcerated,
Right.
who are confined and are nicotine dependent. There's a role for e-cigarettes in reducing tobacco-related harm in the confined population as well. So it just starts from the basic principle that there are people who will not respond to conventional tobacco control measures and they continue to smoke or continue to want to consume nicotine. If we can give those people a smoke-free source of nicotine to use instead of continuing to smoke, they will substantially reduce the risk of developing lung cancer, other cancers, vascular diseases and COPD. And therefore that's what we should try and do. If they're not willing to quit immediately or quit anytime soon, then we can at least provide them with a substantially safer source of nicotine, and that applies to pregnant women with other guidelines about it's not just a case of advising pregnant women to use an e-cigarette, it's working with them over time to help them become abstinent from all nicotine and tobacco use, but in the first instance to help them stop exposing their body and their unborn baby to the harms of cigarette smoke. That's the primary concern.
Very well. So isn't that amazing that a government in a developed country such as the UK is putting out this amount of information and this level of information, and here we are just across the ocean in the US, and the government's attitude is frankly cannot be more different. What do you think, why is that happening, and how come when science has been developed here in the US as well as in the UK, how come we're stuck here with a regulatory regime that is so hostile to the vaping industry to the point where it threatens its very existence? Why is that, do you think?
I think fundamentally, in the UK we use the precautionary principle in favour of e-cigarettes. In the US you use the precautionary principle against e-cigarettes. FDA will say that there's just not enough data, either short, medium or long-term data on the health impacts of short-term, long-term vapour inhalation, and therefore it's not willing to rule or to embrace or reject in one way or another so far. In the UK, we say, look, we feel we do know enough about the short-term risks, of the short-term impact of switching from smoking to vaping, and of dual use of the products. We know enough about the ingredients. We know enough about the aerosol emissions to know that it's very unlikely that the habitual use of these products, vapor products, are going to cause anywhere near the level of harm that is associated with continuing to smoke combustible tobacco products. It's just a logical inference. Now, we also say that we will always continue to study and monitor both changes in technology of products, changes in delivery of nicotine, changes in who's using the products and how frequently and at what volume and with what effect. We will always continue to study those and monitor for those changes. But at the present time, we feel there's enough evidence to recommend that people who are smoking combustible tobacco products be encouraged and assisted to switch to a vapor product at the soonest opportunity if they are not willing to quit smoking completely. And the other broad point I would make is that I feel sometimes that the focus of research or concern in the United States is different from in the UK. The principle of tobacco harm reduction is that we need to encourage and assist smokers to switch to products that will reduce their risk of cancer. We're concerned with eliminating cancer from society and all the other diseases that's caused by smoking. The health of the population is the chief concern. We are only a very distant second concerned about the use of nicotine in our society. We appreciate and acknowledge that nicotine use in and of itself presents very little risk to the health of a society. It's not a particularly hazardous substance in itself, and it's not associated with the development of cancer, cardiovascular disease, and COPD. So there are two issues. There are products that cause cancer, and there are products that don't cause cancer but are dependence-inducing. They can be addictive to an extent. What we see as the role of e-cigarettes is to eliminate cancer. They're not going to eliminate nicotine use. In fact, continuing to use nicotine can actually be the solution to the smoking problem and therefore the cancer problem. If you can have products that deliver nicotine without smoke, you can begin to tackle the causes of cancer, eliminate the exposure to products that cause cancer, and allow people to continue using safer sources of nicotine. I just feel that in the UK we're concerned about eliminating cancer from society, and in the US there's an equal concern for cancer and addiction.
Right.
And I would say that cancer and addiction are not equal enemies. One is far worse than the other. To the question of, people in America may say we're not willing to replace one addiction with another, and I would say I disagree with that. I would say addiction or dependence to an extent on a low-risk product, a product that in our view carries 5% of the risk of combustible tobacco products, can be a good thing in a sense if it keeps people from relapsing back to smoking a product that will kill 1 in 2 people. That nicotine is not the enemy here. Nicotine is actually part of the solution to the smoking problem, to eliminating cancer. So I think we in the UK have begun to embrace nicotine as the addictive agent, but not the harmful agent. And I'm not sure whether there's a broad understanding, cross-disciplinary understanding in the US right now that separates tobacco from nicotine psychologically, separates smoke from vapor, separates harm from addiction. I think we're beginning to do that. That's the philosophy of harm reduction.
Thank you, Dr. Russell, for taking the time to share your thoughts with us. I know you're traveling all over the world, and I really wish for you to have many opportunities to speak with government officials around the globe and to communicate what's happening in the UK, also the results of your many surveys. And to you, the audience, thank you for tuning in and for watching yet another webinar from Nicopure Labs. Looking forward to bringing you more useful information. Have a great day. Thank you for your attention.